Dear fellow leaders, we know you have a lot on your plate right now.
Every day you face difficult choices to save the lives and livelihoods of your people. So if you hear one message today, let it be this.
To end this crisis and build a safer, healthier future, now is the time to act for health systems that protect everyone.
We have learned a lot about COVID-19 and we know what it takes to build systems that protect everyone. We urge all of you to take these actions with us.
Prioritize universal health coverage now to beat COVID-19, alleviate anxiety and rebuild trust.
Fight systemic inequities by creating strong social and financial safety nets for those who need them most.
Get specific with your targets and communicate clearly and consistently with the public. Ensure that 2021 budgets allocate resources to health coverage.
Support, protect, and care for health workers, period.
Invest in primary health care as the first line of defense against outbreaks and the foundation of strong health systems. Health and finance ministers should work jointly for that.
Build partnerships through genuine civil society engagement.
Empower women who are proving to be highly effective leaders in health emergencies.
Rate universal health coverage principles more in every crisis response.
COVID-19 has been an extreme stress test for universal health coverage everywhere. It reveals gaps and inequities that should have been addressed long before the virus struck.
Remember, you committed last September to make these things right.
By taking these actions now with us, you can help societies emerge stronger.
Fellow leaders, we can reach health for all. First, we must protect everyone.
Thank you, Mashkur, for that fantastic video, and welcome everyone to the final session of the 2020 Africa Healthcare Students Summit. My name is Dr. Myria Wangari, or MC for short, whatever will work for you, and I will be your moderator this evening or afternoon from wherever you're tuning in, or even morning. I see we have a few people from Malaysia even joining us in today. So today we are finishing off with a bang. We're discussing money matters, all things regarding healthcare financing, and rethinking financial models with regards to healthcare financing in the Africa region. Our panel has a lot of expertise from various regions of this world. We have West Africa represented, we have Europe represented, we even have an East African represented, and they're all doctors with vast experience, and it's my esteemed pleasure to have them all on board today. And with that, I'd like to start with a round of introduction of our wonderful panelists. Mashkul, could you kindly share the slides? So let's get started. Our first panelist is Dr. Myria Koutsoumpa. Dr. Myria is a global health advocate, and she conducts research on macroeconomics, political economy, and financing for health, focusing on the countries of sub-Saharan Africa, and with a special interest in the fiscal space of health, human resources for health, and global health initiatives, such as the Global Financing Facility and their coordination and alignment. She analyzes policies and decision-making processes, shares knowledge, and collaborates with other civil society organizations and networks, and advocates for sustained policy change that can strengthen health systems for all with an eye on human rights, gender equality, and social justice. Before joining Wemos, Myria worked as a clinician in public hospitals and private practices in Greece and the National Health Service in Scotland. She holds a master's degree in global health from Maastricht University, the Netherlands, where she specialized in global health policy, economics, and management. For her master's thesis, she focused on fiscal space for human resources for health in Uganda. before undertaking her studies in global health, Myria studied dentistry at the University of Athens in Greece. For all our dental students who are here with us, I think this is someone who we should really aim to emulate. And before we proceed, I'd just like to hand over to Myria just to say a word of introduction before I introduce the next panelist.
Thank you, Marie-Claire. It's really nice to be here, and yeah, I assume I'm surrounded also by fellow dentists and doctors and health professionals to be. So looking forward to the session, and greetings from Amsterdam.
Fantastic, fantastic. Let's head over now to our second panelist. Mashko, you can just share this next slide, please. Our next panelist is the strongest man in this panel today, representing the male gender, the most fantastic doctor I've ever met with regards to empowering healthcare students in Nigeria. He once shared that Kenya was his second home, and I hope by the end of this session, we'll convince him to make Kenya his first home. So he is none other than Dr. Adenkunle Adeyemi-Dora, and he is a graduate of medicine from the College of Medicine, University of Lagos. He did his postgraduate training at Lagos University Teaching Hospital in diabetes and endocrinology. He has spent the past 11 years in the pharmaceutical industry, first in Novo Nordisk, which is a multinational pharmaceutical company specializing in diabetes therapies as a medical advisor. Then he rose through the ranks to become the medical affairs and global projects manager for Sub-Saharan Africa. He later worked for 5 years as the country manager of Mylan Laboratories, which is a US-based pharmaceutical company responsible for their Nigerian and Ghanaian operations. Currently, he is the CEO of Medical Entrepreneurs Limited, a healthcare consulting organization focused on entrepreneurship development in the healthcare industry, a passionate trainer and speaker, and he's also a certified member of the John Maxwell and a trained executive coach. He also serves as the board of Solid Foundation Teams and Youth Ministry. Dr. Adenkunle, please take the floor and just say a small word of introduction before we proceed.
Well, good evening, everybody. It's an absolute honor and pleasure to be here. Why I am most honored is because you guys are the future. You're not even the future, you're the present and the future combined together. So it's an honor to be here, and I'm sure we'll have a great time.
All right, fantastic. And now let's head over to our last final panelist. She's none other than Dr. Rispah Walumbe. And small tidbit, she's one of the people who taught me all about universal health coverage. And she's a fantastic trainer, and I'm looking forward to what she has to share with us today. And Dr. Rispah Walumbe is a global health specialist with a focus in health policy and financing. She embarked on a global health career as a medical doctor, where she served as a senior medical officer in the public sector, working predominantly with vulnerable populations in rural and low-income urban areas in Kenya. She's a public health researcher and an advocate for improved access and quality healthcare services through UHC. And she has supported, trained, and mentored over 200 healthcare workers across the country in emergency, obstetric, and neonatal care services. Her advocacy experiences, which she began as a medical student, stretched from local to the global stage on matters ranging from health to social protection and the youth agenda. As a young student, she lobbied for the rights of youth at the Open Working Groups for Sustainable Development Goals in New York, where she delivered an intervention on behalf of youth from all over the world. Her recent portfolio includes supporting health financing reforms in Kenya for universal health coverage through the Ministry of Health, and lending her technical expertise to the organization to the AHESS Commission on the State of UHC in Africa. And she is currently working as the health policy advisor in the executive office at Amref Health Africa headquarters. Dr. Rispah, please feel free to take the floor to just say a small word of introduction.
Hello, everyone. It's lovely to be on this panel. Thank you so much for having me. I look forward to the deliberations. I'm really excited. So thank you.
All right. So now let's just do a brief overview of how this session is going to run. As we had announced earlier to the participants. This session will be 2 parts where we will be discussing healthcare financing, rethinking financial models in the Africa region. Then later we will also be having our closing ceremony. So with regards to the healthcare financing session, we will be having this in 3 parts. Part 1 is with regards to having just more of power talks or presentations or a TED Talk style from our panelists on basically what they think healthcare financing is in the region and why we should be engaged. Then that will be around 20 minutes. Then thereafter, we will engage in now the panel discussion based on what they've shared and their experiences. And then finally, we will conclude with a round of question and answers. Then we head into part 2, which is the closing ceremony. So with that, I would like us to start with our presentations, and we will start with none other than Dr. Rispah Walumbe.
Thank you so much, Marie-Claire. I'll just do a quick projection and then we can begin. So I looked at the guidance that you had given, and I think my job was to kind of give health financing in a nutshell. First of all, I hope you can hear me and you can see me, and we can go ahead. Great.
Yes, we can.
Fantastic. So I'll just go ahead. One of the things I always say when it comes to healthcare financing, and really just the work of a health economist, is your job is to look at choices. It's all about choice. And the first thing you do is you have to think about all the choices that are available to you. So you sit there, and a lot of the work starts in the processes happening in your brain. So you have to think through all these choices, and you have to make these choices. And also you have to make these choices explicit in terms of why you've made the choice, how you've made the choice, and why someone else, given the information that you have, would make the same choice that you did. So I think one of the things also to say here is that it's important to understand your choices because they determine a lot about who you are. And this is one of my favorite quotes because it also comes from my favorite movie. And it says, "It is our choices that show us what we truly are, far more than our abilities." And if anyone knows this, I will, give them something special, because this was said by Albus Dumbledore in Harry Potter. So just moving right along in terms of choices. First exercise I want to give you, because I didn't know what level we were starting on. So I always usually like to take it back to the basics. So the first thing I want to tell you is you're going on a journey. And remember, just keep at the back of your head, you have to make certain choices. So if you're going on a long journey, there are certain things you have to consider. So when you start off planning your journey, you make certain considerations. So for instance, you might decide the mode of transport. It could be a car. And in that choice of your car, you could say, if resources themselves are not too much of a limitation, or that you have a certain amount of resources, you might say, I'll choose between a Bugatti Veyron, for instance. But you also have the choice of choosing between a Toyota Corolla. Just 2 examples. The other aspect is the fuel consumption. So you have to think about, how much fuel do I already have in my tank? How far am I going? Can this fuel get me there? How many stops do I have in the process? The other process is, how many passengers do I have? Are my passengers going to require, are they too many? So do I need a bigger car, for instance? So these are the kinds of things that roll through your brain if you're preparing for a journey, right? The other thing you have to consider is your journey itself. So are you considering the terrain? Are you looking at how rough is it going to be? Do I need an off-road car? In that case, you might look back at your choice. Let's say you started off choosing a Bugatti Veyron. It's not that it's a bad choice. It might actually be very useful for what you want to do. But if I tell you have to ferry 15 passengers across 150 miles, then you might reconsider your choice, because if you look at the fuel consumption of a Bugatti Veyron, it's almost 78 liters per 100 kilometers, right? But if you look at a Toyota Corolla, it's actually 4.4 to 8.4 liters per 100 kilometers. So you might say, given the resources I have, given what the number of people I have to ferry, it might make more sense because I only have 2 seats in the Bugatti Veyron, but you might have a big Toyota Corolla and you have about 5 people. The other thing you need to always consider, and if 2020 has taught us anything with COVID-19, is fail-safes. You have to look at how you prepare for emergencies. So you think of your spare tire, you think of how many places do I have access, how secure is the place I'm going to, you think of your first aid kit in your back seat. And these are simple things, but this is really just the thought processes that really delve into looking at healthcare financing. Or if you're talking about looking at health economics, because health economics is not different from general economics in that economics is about choice, and it has a lot to do with choice, and health economics and healthcare financing is not very different. So there's three things that health economists usually consider when they're preparing or they're working within a healthcare financing system. Firstly, you look at how efficient is your healthcare financing system, how effective is your healthcare financing system, and how equitable is your financing system. Those are the three things that run at the back of your mind. Beyond this, you also look at something that is kind of like the bane of health economists' existence, it's opportunity costs. Because when you make one choice, you forfeited another. So those are the kinds of things you have to sit down and measure. So I think just jumping into kind of like a few details, really the purpose of a health financing system is to collect money from different places. And when you collect money from different places, you have to pool it together, because that's a more efficient way of you channeling the resources so you can actually purchase services. So when you look at the three tenets of the health financing system, you want to make sure you have enough funds for healthcare. This is the core purpose, right? You want to raise sufficient funds for the healthcare system that the health financing system is serving. But more so than that, you also want to ensure that seeking healthcare does not push people into financial catastrophe. And this is really, you can start to see universal health coverage coming into the picture now of why health economics is really important. And then thirdly, also look at how you make sure that you pay for services. So it's not just about having enough money. It's not just about making sure people are not paying at the point of care, but it's also about how you pay providers and how you create incentives, how you make sure that people don't overprescribe or underprescribe certain services. You make sure that they're able to provide services that are actually needed. And so, as I said, there are three steps. So you collect money from different sources, and that's how you mobilize resources. The second thing is you put these resources together, and then the next thing is you purchase services. So one of the things I was also asked, and this is a hard question to answer, is why is it so important for the healthcare system to have a health financing system that does all these things? And this is something that applies actually to many countries outside of Africa, but especially for Africa. One is that there is a limited pool of these resources. And there are even higher demands on the few resources that you have. So you need to be very careful about how you manage your resources, right? It's kind of like having a household budget. You don't want to go over budget. The other thing is you also have to make explicit choices. So going back to that choices conversation, and how you make explicit choices with the available resources. And by this, I mean clear choices, just as I had said above. The other thing is that the health financing system really does determine a lot within the healthcare system, because healthcare outcomes are actually driven by some of these choices that we make. So some of the interventions that will be available in our hospitals are decided by that. Some of the outcomes, the final outcomes that people have in terms of the numbers we see, all of that actually makes a lot of sense in terms of how we finance our healthcare system. And then finally, and most importantly, is to create a balance between efficiency, effectiveness, and equity. So as I close, just going back to the first question I asked, if you had a choice of going on a journey, would you choose the Bugatti Veyron or would you choose the Toyota Corolla? And one of the things I always say is that there's a right answer for the context that you're working in, but also it depends on what your needs are and how you decide to distribute these resources that you have, because these resources are finite. So thank you so much.
All right, that's really a fantastic way to introduce healthcare financing. I want us to now change gears a little bit. I know many a times when we talk about healthcare financing, people just think of the policy side, I want us now to change gears a little bit and now go towards the investment side. And we have the CEO of the Medical Entrepreneurs of Nigeria with us, Dr. Adenkunle, to give us his view on healthcare financing and how we can probably be future investors in the health space. Over to you, Dr. Adenkunle.
Okay, sorry, thank you very much, Mary. Let me share my screen. And I'm going to talk about healthcare financing, but from a slightly different standpoint. And it's really going to be much more about you and what you can make happen within. Can you see my screen now? And am I audibly clear?
Yes, you are.
Yes,
Could
you
you
are.
put it on slideshow?
Yes,
Yeah.
it's on
Yeah,
slideshow now.
Perfect.
So I'm going to talk from a slightly different standpoint, and I'm going to talk to each person, and I hope individually, personally, and I hope I can convince you of something significant. And what I want to say is that Africa needs you. And needs you far more than you think, far more than you can believe. But your continent needs you. You might be a student, you might be young, but don't underestimate who you are and what you can do, for Africa needs you. Now, there are lots of problems when it comes to healthcare financing. We talk about raising sufficient funds for health, which means, and that's evidenced by the high out-of-pocket spending in Africa. It's about 39% compared to 22 in other parts. I think the world average is about 22%. Africa's average is about 39%. We need to improve financial risk protection for vulnerable groups. We need to improve the efficient use of resources. And we also need to move this. Improve financial transparency and management. There are problems from all sides of the angle. And the solution to these problems are, one, we need more money. At the end of the day, even if we have the best models, but we don't have sufficient money, there still won't be effective healthcare. I just came out of a meeting today where it was from the Healthcare Federation of Nigeria, and we were weighing that the truth is we don't even have enough money, even in the private sector, to truly cover health, to truly cover healthcare services properly. So we need more money, which means we need to build businesses. We need entrepreneurs to wake up in Africa and come out with innovation that drive value for the country they come in, for the community they come in. To improve coverage for vulnerable groups, we need better teamwork. We need better leadership, where we come together to unite for a common good. To improve efficiency, we need innovation. We need to find new ways of doing old things that improve the outcomes. And of course, we need to be more trustworthy leaders with better values, honesty, and integrity, people who would put country before themselves. And that's true. So I'd like to say we need a new kind of thinking in healthcare. We need a new skill set in healthcare. We need a different type of healthcare professional. There's the healthcare professional that we all know, the one that we've seen who went ahead of us, the one that taught us, that trained us, the one that basically we work with a whole lot. But we need a new generation who are what I would call genuine problem solvers. Because everything we talk about healthcare is about solving problems. And problems can be solved in different ways, but the truth is we are often running around in circles discussing models and ways and debating with governments, but we haven't hit the root of solving the problem. And one of the problems that I like to say is more money. The money must be used more efficiently, but the truth is we need more money. Africa is, I hate to use the word, but Africa is a poor continent. It has great potential, but it needs to move from potential to reality. You need to put that potential to work. We need to create more money and we need to create more wealth. like to say we need to have a mix of entrepreneurs, innovators, and leaders. And I like to say everybody who's listening to me today needs to change his definition of whom he is and become a medical entrepreneur. He has to think on how to create value, how to multiply what he can do, how to do more than just for me and my family, but how do I do for my continent? And we need to move beyond just being the regular kind of healthcare professional and become true problem solvers. And we need to be intentional. So the way I put it is like this, that we will become healthcare professionals is automatic, but we need to become more than just the ordinary healthcare professional. This is a list of top skills that will be required in 2025 from the World Economic Forum. This is the skill set that I think is largely missing in our continent, missing in the healthcare industry: analytical thinking, complex problem solving, technology, leadership, creativity. I might not be able to speak for other countries, but I trained in Nigeria. I did my residency in Nigeria. I still engage in Nigeria. And these innovative skills, this innovative thinking, this strong collaboration is still a problem. Today, we were talking about fragmentation all across. And what I'm trying to put out there is that you might be a medical student today, a young graduate today, but you need to be intentional about building the skills that are needed to become a true problem solver. So you will become a healthcare professional, but you have to go beyond just being a doctor or a lawyer. The healthcare industry needs IT people, it needs economists, it needs financiers, it needs investors, it needs managers. There's a whole aspect beyond just the technical skill that our medical education focuses us on. And we need to look beyond just the medical education. We need to acquire that as a necessity to become good healthcare professionals, but we need to acquire the other skill that will enable us truly solve all the problems. One critical problem in Africa is our inability to unite. We are fragmented. We have different tribes, different races, different genders, and it's only true leadership that can truly bring people together to work together. So I'd like to ask you, what problems do you want to solve in your country? What problems do you want to solve in your industry? What solutions do you want to make available in this country? And then ask yourself, what skill do I need to have them? You will get your healthcare professional skills, but you must go beyond those skills, acquire business skills, leadership skills, economic skills, investment skills. The truth is, you have to be a lifelong learner, and you have to learn a whole lot more beyond just the medicine or nursing or physiotherapy that you are learning. We need leaders in Africa. And like I said, we need leaders at all levels, young leaders and older leaders. But the truth is, I honestly believe the future of the continent lies in the hands of the young leaders. I'm thoroughly excited and tripped by what Marie, Otobo, and Co are doing, because they're showing leadership. If you're expecting somebody to hand over to you a prosperous and functional African continent, you will be highly disappointed. It's not functioning. And the truth is going to take a younger generation to do it. And it's going to take personal leadership first, where you show fruitfulness and effectiveness at your level, and then, of course, at your community level. So what would I tell a young medical student today? Well, I'll tell them what I tell them in the coaching programs I run for African leaders. You have to go on a journey of self-discovery. You have to identify who you are, the gifts you have, the talents you have, what are you passionate about. You have, see, without knowing who you are, you won't know what problems you have been created to solve. But when you identify who you are, then you know what problems you're going to solve. Then the next thing is you develop a dream for the future, and more importantly, an action plan that starts today. You don't have to wait till you're 50-something or 40-something to be effective, and I'll explain that. Then you need to find like-minded peers who you'd work with. You need to understand that the future is much bigger than medicine. When you're in medical school, Now, simple experience with you as I round up. When I graduated from medical school, I did my compulsory 1-year housemanship and I did my compulsory 1-year national youth service. And I made a decision that I was convinced that my purpose and destinies were tied to Nigeria. So I didn't join most of my classmates who left the country and went to the US or the UK, and some went to Trinidad and Tobago. And I joined a private hospital that wasn't really very functional. And I made a decision that since I was here, this hospital had to change, it had to improve. Again, I was just a recent graduate. And so I rallied my other colleagues who were doctors, we rallied the nurses, we began to have hospital meetings, we began to review our practices. I even realized that we were doing a lot of misdiagnosis by simply having hospital meetings where we, as what you call general practitioners, started going back to testing our practices. In a short while, we rallied the nurses. One day, the medical director called me. He was an elderly man. And he said, okay, if I was going for my residency training program, when was I going to come back? And I asked him why. Well, he said he was building a much bigger, a 3-story building hospital. And he wanted me to go and head it. And I was tickled because here I was 2 years postgraduate from medical school. Did I have the true skill to run a hospital of that size? No, I didn't. But my passion, my conviction, and my drive to say, you know what, if I'm here, this place must be better, spoke for me. And later he told everybody in the hospital I can hire or fire who I want. He trusted me enough to say, well, you know what, go and review everybody's salaries. And that same drive and passion is what pushed me to do my residency. I joined Novo Nordisk. As an African country, we won the Global Medical Award for the whole globe for Novo Nordisk in about 190 countries. And I moved on to other things. What I'm trying to point out is that even at student levels, I mean, let me use 2 simple case examples as I close. We all know Mark Zuckerberg and Bill Gates as global IT people. But what they developed, they began to develop while they were university students. And I'm so convinced the future is IT, AI, IoT, all those technological things. You don't have to wait till 10 years. You can start now. Choose a problem to solve in healthcare. Choose a problem to solve in your continent. Develop the skills. Build mentors, people who point out ways to you, and you can make a huge difference. Thank you very much.
Thank you so much, Dr. Adenkunle. That really does leave us with a lot of food for thought. So let's continue on with the presentations. Last but certainly not least, we have Dr. Myria, a good friend in Netherlands, just to present her perspectives and her vast experience on healthcare financing. Welcome, the floor is yours.
Thank you, Marie-Claire. Let me try to share my screen and hope it works. Can you see it properly? Okay, perfect. So thank you to the previous panelists. First of all, I think you illustrated very important points in the matter of choices and that one needs to take in health financing, and also the need for innovation to move forward. Of course, thank you again for having me. It's an honor to participate in this Healthcare Student Summit, especially in 2020. Because 2020, on the one hand, of course, has been defined with the global health crisis that we all know, but it's also the year of the nurse and the midwife by the WHO. And I guess that most of you attending here today are health workers in the making: nurses, midwives, doctors, dentists, physiotherapists, you name it. And I can imagine as well that when you struggle with complex subjects such as physiology, microbiology, pharmacology, and other ologies, the least you want to add is, on top of that, is financing models, percentages, policy talk, and the rest. And I'm really talking from experience here, because as also Marie-Claire in the beginning, before starting to work as a global health advocate and before starting to focus on health financing, I was a dentist. I was doing clinical work. And in my 6 long years of studies in the university and clinical practice in the university, we really never talked about budgets. We never talked about financing models or policy making or policy implementation. This was just someone else's business. And then when I started, when I graduated and started working as a clinician, I really didn't think too much about it. I was treating my patients, I was removing their pain, I was making them healthier and happier, and that was my job. And it was basically after some years and after being exposed, that was important, after being exposed in different models of health financing in different countries where I have worked, that I realized that as a clinician, you don't work in a silo and you are part of a broader system, and anything that you do in your clinical work is always linked with other elements. And maybe you are familiar with the 6 building blocks that the WHO has defined as the building blocks of a health system. In case you are not familiar, and no worries for that, I had no idea about that when I was studying dentistry. They are the following. So it's service delivery, it's the health workforce, and we are all part of that. It's the health information systems, the essential medicines and the access to them, governance and leadership, and last but not least, of course, it is health financing, which is the focus of our discussion today. And the reason I wanted to mention these elements is to highlight the value of system thinking in healthcare, because it is only when these all elements are in place that the health system can be responsive, it can be efficient, effective, as Dr. Rispah said, resilient, and provide quality healthcare that is available, accessible, and acceptable to all. So with an eye to equity. And it's not an either or question. Either you are a health service provider or a health economist or a global health advocate. In my case, yes, I stopped my clinical career because I found my passion in health systems, in global health policy and financing. But I'm thinking that even if I had continued as a clinician, I would love to be equipped with these skills and this knowledge. It is basically this knowledge that makes you realize why you are doing what you are doing, which are your barriers for doing your work properly as a clinician, and when do you need to fight in order to contribute to the right to health. Because practicing in your clinical practice, practicing in your hospital, it's not something that is happening between the 4 walls. It's outside these 4 walls that the choices that lead you to what you're doing are being taken. So as I always say when I teach to global health students, one always needs to ask several times the why question. And as a health worker, it can go like this. So imagine that you are a nurse and you are overworked in your public facility. Why am I overworked? Because there are not enough nurses in my health facility. Okay, and why there are not enough nurses in my health facility? Because the government has issued a recruitment freeze in the public health sector, for example. And why this is happening? Because the budget for the recurrent costs of healthcare is not enough. And why is not enough? Because the country spends a lot on repaying a loan, for example, servicing a debt, and so on and so forth. And one realizes too often that going back answering the why questions often leads to the financing discussion that we are having today. And that's why we are here today, to talk about this. So I'm really looking forward to talk more about it and talk about the health financing models in Africa and the linkages between health workers and this kind of policy discussions, and why we need to link the 2 worlds. And this also reminds me what Dr. Rispah said before about ministries of all the stakeholders working together. And it was also in the video that we watched in the beginning about ministries of health working together with ministries of finance, for example. So On the screen, I just have my contact details in case anyone wants to reach me, and the contact details of our civil society organization that is based in Amsterdam, where we are really focusing on health financing issues. So just reach out if you feel so. And yeah, I'm looking forward to the discussion, and thank you again for having me here today.
Fantastic. Thank you so much, Myra, for that. And now let's jump into now part two, based with all the information and all the powerful messages that you've given us from your respective talks. Now let's just dive deep into this conversation. And I'd like us just to, we've already talked about basics. Most all of you have mentioned the basics, but I'd like us just to highlight, because I'll be honest, as I was preparing for this session, our topic was rethinking financing models. Then midway into preparing for the session, I realized, but wait, there's still a huge gap with healthcare financing. So I'd like to first pose this question to Dr. Rispah. In the most basic way possible, please just define for us healthcare financing and why we as healthcare students, and even for the junior healthcare workers who are with us, why we should really be engaged in matters to do with healthcare financing.
Thank you. That's a very loaded question, Marie Claire. But yes, I'll try and answer it. And I'll also look to my fellow panelists. But really, healthcare financing is basically how money moves in the healthcare system, how it is collected, how it is put together, and how it's used, and how it delivers on the goals of the healthcare system, right? So assuming that we have the same goal of saying that we want to make sure that people have access to services, those services are quality services, those services are effective, and they're distributed equitably, then this is just, and I'll go back to my analogy of the car. Let's assume the car is the system, right? That car needs fuel to run. That car is taking passengers from point X to point Y, right? So I think it's health financing is a part of a way bigger system. And it's just one of those things that is a really useful tool to progress the goals of a healthcare system. So for me, I started my journey with healthcare financing. I think I was in 3rd year or 2nd year of medical school. I found myself trying to figure out, like, but why is this a problem? Why don't we have X at the facility? Why do we have very many healthcare workers who do not have employment, yet we have, if you look at the ratios that we're told to expect, that we're not hitting these targets. I always found myself asking why, because it didn't make sense to me. And then I looked at all the things that happen before a policy is put in place, and I was like, wait, this is a lot. This is crazy. This is how people make decisions. But I found it exciting, and I was like, I really jumped into it. And I think for me, my journey started, as I said, really early in my university life. I just as Dr. Adenkunle said, I quickly ran to people who were thinking like me. I was like, let's find them, because I can't be the only one who's noticed this. There must be a problem. So for me, that's how it started. And right now, that's why I'm sitting where I'm sitting, because I try to figure out all the things that are in the nooks and crannies of the healthcare system, the things that haven't been revealed, because I think medical students have, and all healthcare students have such a really big opportunity, because especially when you start practicing, and even before, you start to see these question marks, like bubbles come in your head, and you wonder, but why? So I think why it's important for healthcare students to understand how the health financing system works is because it determines how you do your job. It determines why you do your job. It even drives you to do your job. Because if you have all the things you need at your disposal, because I think that was one of the things that was a big challenge for me when I was practicing, is I didn't understand why, for instance, I'd be in a city clinic, and this is like the capital city of my country, and there's no water, there's no running water. And I'm still expected to admit patients, and I'm still expected to deliver on services as best as I should be able to. And there's a lot of challenges that you keep getting. And actually one of the I really look at healthcare workers and I think they're the best decision makers because they're the ones who create the value in the healthcare system because they're able to do so much with so little, right? So I think it's really good to understand the why, but even more so is understanding that in a lot of countries in Africa, healthcare workers have been the drivers, have been the advocates of changing the system, of changing the issues, because they're actually not only the advocates for themselves, but they're also the advocates for their patients. So I think it's really important for the people who are listening in to understand that's your role. Like you are an advocate. You're the only person who represents the patient in totality. And even the government looks to you for that insight, even though they don't directly say it. They look to you for that insight, and there's an information asymmetry because your patient doesn't know that they're supposed to get X, Y, Z. This is not, they don't have like a package which says these are the medications you're supposed to get and everything. So I think that's just what I would say in terms of there's this big world and there's a big opportunity for healthcare students to delve into.
Thank you for that. It was a loaded question, but it's been a loaded answer in return. So I think thank you for demystifying healthcare financing. Now let's go into the second part of this session and just defining a brief overview of what financing models are, especially in the Africa context. I'd like to present that question to Dr. Myria, just to probably in a summary, just define health financing models to us, because this is always something we leave to the policymakers, but we have just been told we are leaders in our own right. So we want to have a little bit of knowledge on that.
Perfect. Thank you, Marie-Claire. So as my fellow panelists said before, some of the key, let's say, the key elements of health financing is the mobilization of the resources. So how you raise money for health, the pooling of the resources. So getting all this money together in a pot, and then purchasing the services, utilization of the existing money. And of course, each country, its country follows different policy pathways to take the decision in each one of them. So, we cannot tell that there is one health financing model. There are several ones. And I'm going to really briefly tell you about some main health financing models that have to really, that combine these three elements. And I will give you just a country example in each one. So first of all, we have what we call the socialized medicine. So it's called the beverage model. And in that case, the healthcare is provided and financed by the government through the taxes that the citizens pay. And this is, for example, how the National Health Service system works in the UK. Then, if you go to the Netherlands, where I am at the moment, we follow the Bismarck model, where there is an insurance system where the insurers are financed jointly by the employers and the employees through the payroll. So each employee, when you work, some money is deduced from your payroll, from your salary, and go to these funds. They're pooled, and then you can purchase your services. Then, for example, in countries like Canada, there is one insurance program, the National Health Insurance Model, where every citizen pay into that fund, which is publicly run, and this fund then pays for the services. As you understand, for these kind of models to work, it's important to have like formalized employment, a formalized economy. And in many cases in the African context, that's an issue because there is a very large informal economy. So it's very difficult to deduct parts from salaries to put in this kind of pots, or to deduct from the tax payments, etc. So there is also the out-of-pocket model. Of course, the out-of-pocket payment, so what you pay at the moment as a household to get your services, exists in all countries in different percentages. But in the African context, it's very prominent because the health system is weaker. So in general, the percentage of these out-of-pocket payments as a percentage of the total health expenditure of a country tend to be higher the weaker the health system is. And as you can imagine, this is the most inequitable and the most regressive form of paying for your health. And it often leads to catastrophic health expenditure and deepens poverty, because a household can really be destroyed in a moment of health needs where you have to pay at the time, find money to pay to get your services. And as I said, when you pay out of pocket, this excludes any prepayment for health services, which is the basis of social protection. So the money that you get from the taxes or from insurance programs, etc. Reliance on out-of-pocket payments varies, as I said, across the globe, but is a very good indicator to monitor how well a health system is performing in terms of financial protection. Okay, so it's a key indicator. Of course, sometimes low out-of-pocket doesn't mean that we have a very equitable system that protects everyone. It also means that people avoid accessing the health services because they know that they're going to get financially destroyed. So it doesn't register as out of pocket. So it's not clear cut that when we have low out of pocket, it means, great, we have a health system that operates well. Important to note that. So in high income countries, more or less, the out of pocket is like 20% of the total health expenditure, 15 to 20%. But in the Africa context, where apart from Mauritius, all the other countries are low and middle income countries, it's much, much higher. So there are cases, for example, like Ethiopia, that you have 67% out of pocket payments. So and the insurances are very low. And for example, I will give you an example from Uganda, where I did research there. Only 5% of the population was covered under health insurance, so they had some kind of social protection, and only 11% of the people were even aware of health insurance at the time when I did my study, which was 2 years ago. So I will leave it there. I hope I didn't complicate things a lot, but I wanted to give you these two different ways of paying for your healthcare. One is the part that protects you because it's prepaid, it's subsidized by the state, it's subsidized by the employer, and the other one is when you go and you have to pay the bill at the time. So over to you.
All right. Thank you so much for that. I think you've really demystified financing models. And I'd like to now change the gear a little bit and ask Dr. Adenkunle. You have mentioned how med students really have to do a lot of self-introspection with regards to their future. And part of the future is new digital health, digital probably health telemedicine. So in that regard, though it's not really related to healthcare financing, my question really is, what new frontiers are there with healthcare financing, especially in the times that we are living in now?
Thank you, Mary. If you don't mind, I'll just jump a little bit back on the question Dr. Rispah and Dr. Myria took. They are more knowledgeable than me in the context of the expertise of healthcare financing models. But I would like to take the word financing and add another word to it called literacy, financial literacy. Each person, we're not talking to indigent patients, we're talking to the leaders of the healthcare system today and tomorrow. So I think it's critical. Every medical student, every doctor, nurse, physiotherapist begins to become financially literate. Because at the end of the day, it's the resource you have that you learn to multiply to create more value and more resource. When I was a resident doctor, I think one day I had what I call an epiphany moment. And I looked at all my professors and all my teachers. And I say this, they were great people, great teachers, honest people, intelligent people, hardworking people. But when you look at where they would end up financially and economically, it's not what they deserved. And I guess that will do for it. I'm going to inform my thing. Like, you know what, I think I'd better jump out a little bit, explore and see what's happening. I can always come back. I think healthcare and financing are inseparable. I have to say that healthcare, whether we like it or not, is a business. Because why? It has to be paid for. I like to say, if you're not paying for it, and somebody's not paying for it for you, then you're not getting healthcare, because healthcare is not cheap. And that means that we have to understand money and how it works, how to multiply it, how to do more with less, how to create it. How, as healthcare professionals, we take money and resource and multiply it. How Africa can create value that the world can come to. In Nigeria, in 2016, $1 billion was spent by Nigerians in India on medical tourism. Why? A failure of the healthcare business in Nigeria. They felt, I tell doctors, I say, that's your money that went to India. If you run better services here, more comfortable services here, they won't go. And so the financial literacy perspective of money and business, to me, is a core, because it's the same money we use effectively in the healthcare modeling systems. And the more money the leaders have, the more they can cover for the vulnerable persons. So forgive me, that was just a, the money matter, I think, is, we never thought about money in medical school. You're not taught about it in residency. So we have to go and learn it for ourselves, and the earlier the better. Now your question was about opportunities in healthcare, right? Beyond, can you rephrase your question, please? Forgive me, so I don't mix it.
All right. My question was basically new frontiers in healthcare financing. Are there? Yeah. We have been told the standard out of pocket, the prepaid models, be given the basic definition, but is there anything that's new and upcoming with regards to healthcare financing that could be an opportunity for the young doctors and the healthcare students with us today?
Yes, and I will point to one simple area: technology. Technology is already transforming it's already disrupting industries, and healthcare will not be left out. Let me give a simple thought. How do you take 50 naira from a farmer every day or every week and pull that in a much larger system that's taking maybe 100 naira from someone else to bring together the resource that would build hospitals, upgrade primary healthcare systems, train doctors, nurses in rural settings? Because at the end of the day, healthcare financing is about the corporate pool of resources, whether it is from the government taxes, whether you're taking it from people's salaries directly, whether they're coming together as social groups. Technology can fast track that. But it requires talking to people, building their trust and their confidence that if you take their 50 naira, they're going to see the value of it at the end of the day. And a lot of that trust is missing. But technology will revolutionize things. If you look at what they call the fintech industry, there are all kinds of things coming out in terms of payment systems, phone wallets. We recently heard about, I don't know whether you guys heard about it, the Paystack guys in Nigeria that a company in the US bought for $200 million. Why? What are they doing? Simply moving money around. So not Paystack, was it? Yeah, well, Paystack, yes. What are they doing? Moving money around. It's technology. This technology has not yet effectively been captured in healthcare. And an effective healthcare system, an effective healthcare financing system today, more likely than not, needs to be built around some kind of technology. I like to say the people who are in their 20s are their digital babies, digital children. My generation didn't grow up with technology. your generation has. And you can actually start learning technology informally while you're in medical school. I know medical students who code. I know medical doctors who have learned coding and do a whole lot more. So to be honest, if I were back in medical school today, 20 years ago, and I was to make a choice, I would start building and learning technology. Artificial intelligence, IoT, blockchain, they're all guaranteed things of the future. I would simply begin to dig my head. When I'm learning my medicine on one side, I will start learning technology and how to integrate it into healthcare. I will round up with this. One of the challenges, I was talking to a friend, one of the challenges about technology is this. If you're just a core technology expert, sometimes it's hard to employ you. They want to find people who have industry understanding and can link it to technological knowledge. I have a friend, he's a physiotherapist in the US. He spent 9 months learning to code. So now he builds, he has 2 or 3 patents he's running where because of his physiotherapy knowledge, and he learned how to code and technology, he now builds devices that for that. I think one of the things he did had to do with helping stroke patients improve their mobility using technology. He brought 2 worlds together. And that's what medical students need to do today, bring 2 worlds together. Dr. Rispah and Myria have brought the medical world into the healthcare financing world. It can be medicine and IT, it can be medicine and economics, it can be medicine and management, but you need to add to your medicine. Thank you.
Can I add something to that?
Yes, sure, go ahead.
So I really like how Dr. Adenkunle said that what he would do if he would go back in the time of his studies. And really, I was thinking the same in a different direction, because I would really love when I would go back to my medical studies to incorporate the aspect of financial literacy that he mentioned before. And I would combine that also with what Dr. Rispah said, that health professionals are advocates for their patients, because when you're a health professional and you don't have enough resources to protect your patient and do your work, you need to advocate for those resources. But in order to advocate for those resources through your union, for example, to your health committee at the ministry, at the parliament, or to the Ministry of Health, you need to speak the language. You need to speak the language of money. And really, if you ask me back then, I had no idea how to monitor a budget. And that's knowledge that I would like to have, to be able to get the budget plan of the ministry of that year for the financial year, go through it and see which are the allocations, or to judge how much did the government give to healthcare this year, and compare it with targets. You all know the budget target. I think you talked about it before in the conference, to compare it with other international benchmarks that are out there and see why my country is allocating much less than that. Where does the other money go? Which sector gets the money? It's the infrastructure. Why? And when you get to that thinking, you can claim you're right, because yes, health of course is it has the business part because there is money involved, but it's also a human right, and this is something that we need to combine in our thinking. And so yes, I will just close with that. It's another area that I find health financing important for health workers, to be able to claim your right, and to be able to demand that the social contract that you have with your government is being realized. And I'll stop here.
All right, thank you so much, Dr. Myria. Dr. Rispah?
Sorry, I didn't hear your question.
Oh, we were discussing the new frontiers in healthcare financing.
Yeah.
And I was asking if you have anything you'd like to add on that topic.
Oh my gosh. Like, unfortunately, this is a topic, or fortunately, this is a topic I can go on about for a really long time. Like, this is my job on a day-to-day basis. Just talking about this, looking at how our country is thinking through all of this. But I think one of the things that is really important to say, just really adding on to what the other panelists have said, is that there are really important things to consider. There's different paths that a healthcare student can go through. You can choose to go and work in the private sector. You can choose to work in the public sector. You can choose to work in the policy space. You can choose to work. There's just so many opportunities available to you. It's up to you. Identify what your passion is. Identify what drives you. Identify also, because I think also Dr. Adenkunle said, think about 10 years from now. Will you be happy doing the exact same thing in the exact same place? Will you be happy doing that in 30 years from now? And for me, I did love clinical practice. I enjoyed immensely working with my patients. I found so much joy working with them. But the thing that used to give me a lot of tension was when I couldn't give my patients my best. And that drove me to insanity. Like, just, I had to say, wait, there must be a solution. And I went back to what are things that I do well. I do research pretty good. I engage with people really well. I had started engaging with global policymakers while I was still in medical school. I'd started sitting across from ambassadors and ministers of health and asking them these tough questions on a global stage. So I said, how can I take that and make that my job with all the experience that I've had? And so that's basically one of the things that I did. And I think when you're looking at, there's a lot of many technical things that might be thrown around that you might not understand. But I think the first point is have a yearning for that understanding, want to understand. Then you can, it's not like we were all born knowing about the way a healthcare financing system was organized. It's not something that I knew. And it's something that I had to learn, and I just went online. Technology is at your disposal for you to discover what you want to do. So I think there's a lot of issues that different African countries are struggling with. And I often come from the perspective of, I work for a civil society organization, of course, Amref, that's what it is. But one of the things that I also do a lot is work with on the side of government, and I sit with them and I say, how do we do this? How do we unpack this problem? How do we tackle it the way we should? What are the challenges you're experiencing? And often what you'll hear from, don't assume that also governments do not know what they're doing. They do. Some cases they will do it intentionally. Other cases they will do it because they have no choice. They have no option. So understand that there's many things that people are grappling with. For instance, it would be great if we could just inject all the money into healthcare, because I think that's something that's a really good, a good decision. But understand that they're grappling with some of the things that also Dr. Myria has mentioned. There's a large informal sector. So it's great to say, let's collect more money. So you want to collect more money from the people who are working, but a lot of the people who are working actually employed informally. So you don't even know how much they earn, right? So how do you collect that money in a way that's equitable without imposing taxes on the people, imposing very high taxes on the people who are earning money that's in a more transparent and accessible way? Additionally, you'll have them thinking about, well, there's so many different burdens of diseases. There's multiple issues that they're dealing with. How do you make the choice between those two? And I think for me, that's what drove me to shift and say, how can I get into this space so that I can help balance these choices? Because I think truly, and I just go back to the quote I had said earlier, it's not just your abilities that will determine who you are, it's your choices. And now you're making different choices for your dreams. Do you want to have, what do you want for your family? What do you want for yourself? But ask yourself, go ahead and ask, what do you want for your patients? What do you want for your country? What do you want for the continent? And I think the beauty is you're all connected. Use that. I had friends who I'd never seen until like I went for a conference, and we sat down and we made decisions, and we actually lobbied people in the UN, and things changed. A sentence in the Sustainable Development Goals was changed just because of that, and sitting down from across each other. And these are the opportunities that I think really you should utilize at this point, and also plan for the future about how it will look like ahead of time.
Right. Thank you so much for that.
Sorry, I just want to interrupt you a little bit. She said something that warmed my heart. What do you want for yourself, for your country, and for the continent? We have to think like that. And then we have to put our heads together. Business people, economists, civil society. We all won't be in the same spaces, but we must want something for the continent. We must come together and find from our different spaces, make those things happen. I mean, to me, that's what I think this whole conference is about. It's more than just healthcare financing. It's really about coming together as Africans for Africa, building the continent we want. And you see, what I want to say is that there's more than enough capacity amongst young people to do that. Thank you. Sorry for the interruption.
No, that's perfectly fine. So I think we've really gotten some inspiring, all the panelists have shared some inspiring tips and information on healthcare financing. But all of you have also highlighted that there are evident gaps in the medical or the healthcare education curricula with regards to healthcare financing, because most of you have said you interacted with healthcare financing concepts more or less after medical school. And right now, we have the repeating message that we're getting is we are agents of change. We are the leaders of today. What can we do so as to ensure that our curriculums, our various curriculums in our various countries empowers us to have knowledge on healthcare financing? Because yes, we do have the internet and we can go and read for ourselves, but it will also be good if at least there could be something more in our curriculum to empower us on the same. I'll start off with Dr. Myria.
Yes. Good question. I mean, I guess let me think how I would go about it. So, I mean, I said various times before that I wish I had this kind of changes in my curriculum back then. I think what students could do is use, I'm sure there are student bodies in the universities across the continent where you all are. So at least in my case, in the student body back when I was studying, we were discussing maybe other practical things of the university, but really we never challenged the existing curriculum. So I think in the student bodies where you're organized and where you're active, that can be in the agenda. And I'm sure that resources are out there, especially civil society organizations that are operating in the field of health. They do this kind of work on health financing, and there are resources and there are health economists that are linked with them that can help a university develop such a course if it's not there. And here comes also the very important point, and I think the summit that you have been organizing is a step to that, to exchange between universities. It doesn't mean that every health science school in Africa has to reinvent the wheel and start from scratch and make a health economics course specifically for their own students. You can exchange. And this is basically what we are doing here today. But I think if it comes from a demand from the students, it can work. And civil society organization can really support that. I know that from civil society organizations that I have been collaborating with in Uganda, for example, they were developing these kind of courses for health workers. That was the case in Uganda at Makerere University. So it's I think, putting on the agenda of your uni and network with this kind of bodies that can help you with that. And really, the material is out there. So that's my thought on it.
Dr. Rispah, any words of advice, especially with your vast expertise in student leadership and youth advocacy?
You're so kind. Vast. I don't know if I would use the word vast, but I think my experience is really similar to what Myria just described. I started off with a student body. I had a group that I was working with, and that's where my eyes were open to understand that that the knowledge is also inherently within medical students or healthcare students already. Some of them already have this information at their disposal, at their fingertips, because they're already doing one of the things that I wanted to do. And so I started to learn from them, and they trained me, and I consequently also trained others. So I passed it on. I didn't keep it for myself. The other thing that I did is that even in passing it on, I didn't pass it on in like only through that organization. I also, wherever there was, and I think, Marie Claire, you know this, wherever I've been asked to speak, I speak. This was even before I did my master's in London School of Hygiene and Tropical Medicine. Before this, I was speaking to students. I had just finished medical school, but what I was talking about was just my experience in global health diplomacy, in lobbying, and in health systems, because that was my experience. So I really encourage, because yes, I think you should speak with your universities in terms of what can be done, not to change the curriculum completely, but to just increase the content or make the content delivery better. Because I know, for instance, in my university, which was University of Nairobi, for my medical degree, we were taught about health economics, right? But the way it was delivered was, the way it was packaged is definitely not what I thought it was, right? So I think even just the modes of delivery, and this is something that can cut across the different disciplines within, because the public health discipline is part of medicine. It's well, at least to my understanding, it should be part of all like curriculums. Correct me if I'm wrong. So I mean, that's what I would say in terms of where to start, and really don't hide information. The same way it would be strange if you had like a past paper in school and you don't share it, like that knowledge, right? Why shouldn't you? Like, it's not going to make you any cleverer. It's not going to make someone else pass you. It's not like the marks are limited. So I think that's one of the beauties of what students can learn, and learning from across countries, learning from different countries in Africa, but also learn from different countries globally, because you have these platforms. So use them completely. I think for me, I started off so late, and that was in third year, right? And I had till fifth year, and I was feeling like, how have they gone? Can I stay a medical student? Now I'm a bit happier because I have money. But you know what I mean? Like, it's just take advantage of these opportunities while you are young, while you are in the space where it's okay. There's so many fellowships and internships, and there's just so many different opportunities that are available.
All right, Dr. Adenkunle.
Well, on a lighter note, when Dr. Rispah says when she was young, I don't know what she wants me to say. Okay, but when it comes to curriculum, now curriculums are quite difficult to change. I will start with that. I've had lots of discussions with academicians. I almost had a career in academics, and they're really very set in their ways. The reality is there's so much in medicine that even the standard time of medical school can't cover it. I remember diabetes, which is one of the biggest problems. It's just 1 week of lectures in your entire senior year as a senior clinical student. But that's not an excuse, because the world is changing so fast that if we don't review our curriculums and develop young people in line with what they're going to face when they come out into the new world, they're going to struggle. So I like to say, one, I love the idea of talking about student associations, and they need to start taking ownership of their own training. And in fairness, in Nigeria, I don't see this done very often. I know medicine is very hierarchical. So when you have your professor there, sometimes it's very difficult to tell the professor, hey, we don't like what you're doing. But I think in Nigeria with the NSAS tried, they said you're the Sorosoke generation, the generation that will speak up. So you guys have got to come together and say, you know what, our curriculum is incomplete. You've got to take ownership, this is ours, and have a discussion with your lecturers, with the school, and begin to show them, do a lot of research, show them why some of these new things like financial literacy, healthcare financing need to be brought to the table, healthcare and IT. You've got to do the research, gather the information, and have a robust debate with them. You probably won't get everything you want, but then it will even help them reshape their thinking. I did some research some time ago, and in the US, almost 50% of the medical schools have some kind of leadership training inbuilt into the curriculum. Now, I don't know which African medical school has that. I know Nigeria doesn't have that. And leadership is a critical, see, I showed you the 25 skills the World Economic Forum is saying is crucial by 2025. So even if they can't change the whole, I mean, the truth is you have to learn medicine. There's no argument. That's why you're there. But they need to be able to bring these things from a slightly, infuse them into the learning. But understand something. Many of your teachers don't have that knowledge. So it's going to be hard for them to bring in, which is why you need to take a lot of ownership. I also believe that technology can transform a whole lot of things. I mean, we know we have the internet, there's information there. So one, there's a lot of individual decision-making, choicing and learning you can do on your own. But there's a project we're working on, we call it innovative medicine. We're looking at how to innovate in the medical education space. And why? It's because we realize that a lot more can be done. And we've taken it as far in our thinking, in our imagination about how you can actually use virtual reality to reproduce patient experiences so that, for example, in Nigeria, in a typical case in Nigeria, if you're a senior medical student, out of maybe 12 specialties in the internal medicine, you'll only do 2. Maybe gastroenterology and neurology, which means you don't really get to know core cardiology, core dermatology. You miss out on quite a bit of things. But you know, virtual reality can actually reproduce those things, make them available and reproducible. So I still think there's a whole lot that can be done. Technology will make learning easier, faster, quicker. I think we need to take individual ownership personally for where they want to go. I think the associations can do research and have a discussion with the lecturer that, see, we need this added to our curriculum because of A, B, C, D, E. And if the university is not yet ready to make the change, engage with professionals, associations, industry people who can maybe, you know, like create some kind of parallel courses through your associations that you can learn some of these things. Thank you.
All right. Thank you so much, Dr. Adenkunle. So now I'd like us to shift gears a little bit and discuss probably key policies that are relevant with regards to healthcare financing. And I think one of the key policy documents or key documents that comes up always is the Abuja Declaration. So I just wanted us to discuss how far are we ever going to attain this Abuja Declaration, especially given the times we're in with the COVID pandemic and its effects on healthcare financing. So I'd like to start off with Dr. Rispah on that.
Great. So Abuja Declaration. I think this is something that sometimes a lot of governments, it's a thorn. It's a thorn in their side, but it's also a good driver. Whatever we say about it, it's a driver. It's pushed people because it gave people a target. Now, there's another conversation around targets and what targets do to financing. But let's just shift that aside for now. Let's start with what Abuja Declaration is and how far we've come. There's a lot of reports that have done comparisons in Kenya for how far, in Africa, for how far African countries have progressed towards this magical 15% that a lot of people assume will change everything. But as I said, remember, one, healthcare financing does not operate in a vacuum. It operates in a system. It's supposed to be an enabler of a system. It's not the be all and end all to a system. Two, if you have 15%, let's say we gave 15% right now to a country, are you expecting that in 1 year or in 6 months, everything will have changed? Things will be better. It'll be a magical, situation. No. So I think let's be cautious and careful and understand that this healthcare financing does not operate in a vacuum. That there are certain choices, and I'll go back to what I was saying, that there are choices that need to be made. You make the choice, and often it is the case that governments will make the choice that they won't reach that 15%. And for some countries, it's fiscally impossible, like for them to shift everything and move that to 15%. Others, they're completely in the space that they choose not to, but they do a little bit of increase. They'll do a little bit of a peak. They'll try and increase by 2%. They'll move from 5 to 7, or they'll move from 4 to 5, or they'll move from whatever it is. But there's something that we don't talk a lot about with the Abuja Declaration, because it was in two parts. One part was 15% from African Union member states. The other part was an increase in overseas development assistance. Now, ODA, let's call it ODA for the purposes of today. Now, I think the average that I remember that comes to mind is from 2009, so it's really old, but the shifts are there. But there's so many changes that are happening with overseas development aid that the effects of ODA have been varied. The patterns that you see and the effects that they have had on countries have been very different. So for instance, you'll have the average, the percentage, if you look at the total health expenditure and you look at how much is actually coming from overseas development aid, the average, I think in Africa in 2009 was about 25%. But in some countries, you'd have as high as 50%, right? But now in the situation where you're looking at, wow, let's make it such that we now shift this to, so if you have 50% is coming from overseas development aid, 50% is split between government, out-of-pocket payments, and other things. If you do a sudden shift and remove that 50%, you've made that country extremely vulnerable. And I think the beauty is, and this is where I promise I'm getting to the point of your question, is that African countries are starting to realize this. They're starting to realize that vulnerability, because this is the year that, one, there's been that sudden pull in certain resources from overseas development assistance. Countries have had to sit down and look around and be like, wait, you mean they can do that? They can take it away? We can be left vulnerable? And now they're also starting to shift their thoughts. And I think this is something that the African Union is really thinking through, is how do we make sustainable financing more consistent? Like, how do we make this something that is a big consideration? So that's one of the things that I will say, that there is progression in terms of the thought. And sometimes that's the first step, just shifting the thinking, because the thinking is shifting. From many African countries, they're like, no, we need to be self-sustaining. We need to figure this out. We can't keep relying on overseas development aid, not just because of that sudden removal, although that's a big incentive, but also because of the effects and the restrictions that come with that overseas development aid. Because if you look at the different things that happen, for instance, when you have a lot of money coming in, influxing from, and I'm going to botch this explanation, but there's certain things it does to the economy of that country when you have so much money coming in from external donors. The other thing it does is that it's restricted in terms of how you can use it. So even if you're the person who, as a country, you know what your needs are, you remember the choices, you've sat down, you've said, this is how I've planned, this is what the major issues are. And then someone comes and tells you, I'll give you money, but not to do that. I'll give you money to do something else. So this is where we're grappling. And remember, and that's why I say sometimes people always look at government, but also understand that there's the local institutions that run a healthcare system, but there are also external influences that make a difference for that country. So I think, and this is why I say, again, healthcare workers, when they band together, they can do so much in terms of shifting. So when it comes to how far we've come from the Abuja Declaration, we've come from very far because we've shifted our perception. And 2020 has been the year that has shown us, one, what happens if it goes, all the money goes, but two, also what happens if African countries start to collaborate with each other. What happens when we start to think with each other? What happens if we start to mix our economies and start to think about how we can exchange information? When it came to, I think for a good example is like PPEs, right? Manufacturing. How about instead of buying them from outside of Africa, why don't we think of looking internally? Who can manufacture this? How can we do this so that we are meeting the needs and the goals of our healthcare system, but working as a unit in terms of Africa in itself? So looking at it kind of like the way the EU have a really big economic bloc, Africa is also thinking through those processes. And I think a lot of things have been fast-tracked during this year that a lot of people are starting to say, maybe we were thinking wrong. Maybe we were not looking internally and seeing that we actually have the capabilities within Africa to make these changes. So that's kind of where I would say our thinking, the perception is shifting, but we of course do have the challenge in terms of targets. But I would start by saying leverage on that. And I think it's to leverage on political economy. Now is the time. Now is the time. If you have the political will in your country, wherever it is, run with it. It's a window of opportunity that we call that in policy, a window of opportunity. The agenda is healthcare across Africa. Use that opportunity. Thanks.
All right, thank you so much. I think I've learned something new today about the ODA. I didn't know about that. I think all the time we emphasize about the 15%. It's good to know that there are actually two sides of the scale with the Abuja Declaration. Dr. Myria, anything you'd like to add with regards to the Abuja Declaration, especially given your work in policy with Wemos?
Yes, actually, as Dr. Rispah said, the Abuja Declaration is one of the relative targets. There are more that are also global, not only for the African context. But what I want to repeat is that there is no magic number. And I want to repeat that it doesn't mean that when you reach 15%, there you go, you have your health system robust, ready to serve equitably all the people of the country. But the point is to keep progressing towards that. And I want to raise some more points here when it comes to these kind of international targets. For example, there is another target, a global target, that countries should allocate 5% of their GDP to health. The Abuja Declaration has to do with the percentage of the government spending. This one has to do with the GDP of a country. And we have been discussing a lot that at Wemos. And we are thinking, okay, what does it mean really, for example, for a low-income country or lower middle-income country to reach 5% of the GDP? It doesn't mean much, because when the pie is small, even if you cut a larger piece of the pie to give it to health, this piece will still be small. You know what I mean? So the challenge is to raise the pie in the first place, to have a bigger pie. So the piece that you're going to cut is going to be enough for everyone to take a piece of it. So, and that we are talking now here about the African context. However, what I want to highlight, and I think it's important, is this is also something of a global responsibility, because I mean, we're talking about the state being the duty bearer of the right to health, but there is a global responsibility out of that. And I see here on the chart 15 of an elephant, not the same as 15 of a chicken. Exactly my point. So, and when it comes to global responsibility, what I want to highlight, it's something that I have read recently in a report by UNCTAD that was published in October 2020. So every year in Africa, it was estimating that the continent is losing $89 billion through illicit financial flows, through theft, corruption, etc. And this is way more than the official development assistance that comes into the continent. And this is a matter of global responsibility, and that's a huge pot of money that can be used to increase the pie that we are talking about, right? It has been calculated that the funding gap for I don't remember, I think it was around 370 billion per year for LMICs, low and middle income countries, to achieve the health-related SDGs. If you project that in the future and take into account that, okay, countries are going to raise resources, et cetera, still you're left with a gap of $54 billion. And then you see that $89 billion is being lost because of theft. And here comes why the health sector is not only health, because this is a pot of money that can increase the pie for health. And that's an additional argument in political economy for health workers to make, for advocates to make, that, you know, the official development assistance is not going to save. Like global tax justice is going to save the story. What and which is not charity, is what is right to do. It's not help. It's not being a thief. And I get excited with this topic, so I'm going to stop here.
Thank you for that. Wow, I think that's the best description of the Abuja Declaration. And one thing that's really come clear is the fact that we always emphasize on 15%, 15%. We always say we need more money for health. But as one of our organizing committee members has actually just put it in a comical but yet serious way, 15% of a chicken is not 15% of an elephant. And that's basically it. I think we as young advocates and as healthcare students need to change the way we advocate for healthcare financing. Stop thinking about 15% of a chicken and think of asking for a bigger pie so that even not only health improves, but even your country's economies improve, because a bigger pie means more development, health-wise and nation-wise, because a healthy nation is a successful nation. Dr. Adenkunle, my question will always be on innovative ways students can engage.
Before you ask your question, let me, Dr. Myria she phrased it the way I love to hear it. She spoke about GDP, not government budget. Because just like you said, 15% of an elephant is not the same as 15% of a chicken. Now, how does a government grow its finance for healthcare? I personally think it's through the private sector. And that is healthcare businesses that can develop services, create services. What government needs to do is create an enabling environment. Now, at the moment, and I use Nigeria as a major example, government is competing with private sector. Rather than enabling private sector to thrive and to grow and to expand and create these services in a way that government makes more money from taxes and has to invest less in health. The truth is, Almost half of Nigeria's healthcare systems are public sector driven, which I apologize to say means that they are inefficient, they are poorly productive, and they are poorly delivered. Now, that's why the concept of public-private partnerships have come into play in Nigeria and other parts of Africa over the last 10, 15 years and are growing. Now, what the government needs is that if government has built a big hospital, it needs private sector efficiency, private sector management expertise to make those things work so that their input is so that if they can do more with the less they have. Now, most of the time, government is creating more structure that consumes money, not produces money. Let me give an example. Nigeria has what they call the Basic Healthcare Provision Fund, which is money set aside, I think it's about 1% of the national budget set aside for healthcare. Now, 45% of that is supposed to go to the health insurance scheme, 50% is going to the primary healthcare board, 5% for emergencies. But do you know what they've now said? Every state to access the fund needs to create a state agency that is like the state primary healthcare agency to access the fund. So what have they just done? They've created another little structure that will consume part of the public healthcare fund for administration, for this, for that. And what does that mean? Less value for money. So I think private sector, in partnership with government, properly regulated, can expand healthcare, can create productive, efficient services. I mean, Coca-Cola, you can go anywhere in the world, the most rural village, you will find a bottle of Coke. That's cold chain logistic that's possible by a private sector agency. And I think government needs to see private sector as their partners and see how to enable them do more and achieve more for the nation. And so one of the visions of my company is to be part of Nigeria, to make healthcare in Nigeria contributes less than 3% of our GDP. A 2017 document I read actually said less than 1%. Now in the US, healthcare contributes 17% of its GDP. Global average OECD countries, healthcare produces like 11% of GDP. Nigeria is doing less than 3%. It means that there's potential for health sector, private sector, to grow, expand, and add value and grow the GDP. If those business enabling environments are made possible, we must be manufacturing our own. We must have drug security, manufacture PPE. There's a whole lot of other things that can be done in the African continent and do what they call import substitution, amongst other things. Let me stop there. Thank you.
Thank you for that, Dr. Adenkunle. For me, my next question now, because we've really delved into Abuja Declaration, the private sector, I want us to probably just discuss, are there any other key policy documents that are out there that talk about healthcare financing? Because we also want to at least have something to go and reflect on and read on. So I'll start this question with Dr. Myria. Is there anything else aside from the Abuja Declaration that works or that is relevant to healthcare financing?
A lot, but let me think what could be useful for you guys. So, of course, there is a whole department in the World Health Organization that is focusing on health financing. And I think that's a good source to start if you want to learn more about that. So you go to the WHO website, there is the health financing, and there are many reports there, very recent ones. focusing just on that. There is one, I'm not sure if it's already published, that is called the Do's and Don'ts of Health Financing by the WHO. I have a copy that I got before it was published, but I haven't checked if it was published already, but it's a very good one. And it really helps you understand all the different modalities. So I would really point you to the WHO's website for that. But of course, many CSOs are also making policy briefs and policy analysis of these long documents. For example, if you go to our own website, to Wemos, we have a knowledge platform. You can click on health financing and you get a lot on it. And I'm sure Amref has as well. We have done some things together also. So civil society really produces valuable material on that, on health financing, and including on the private sector. And actually, if I can go back to something that Dr. Adenkunle said before about the private sector that I wanted to add, is that yes, we have seen that the private sector has a lot of potential in health financing, but something that I would like to highlight again for also the students to keep in mind is that when we talk about health, we need to remember also the equity lens. And sometimes the efficiency of the private for-profit sector doesn't come hand in hand with equity. And why? Because, for example, it's not efficient and profitable to start a practice in a rural, hard-to-reach area. In Uganda, for example, like I think 75% of the private facilities are in Kampala. So there is a clash between equity and efficiency sometimes. So there is, when we put profit into health, we need to be careful. And you very well said, Dr. Adenkunle, that the private sector should be regulated and not just left alone, because then people are left behind if the private for-profit sector takes over, because it's not a duty bearer of the right to health. And so yes, I wanted to make this additional point. And yes, WHO is your friend when you want to learn about the health financing, as well as check your country's CSOs that are working on the matter. And over to you.
Thank you. Thank you for that, Dr. Myria. Dr. Rispah, anything like to add? I know so Amref is one of the game changers with regards to policies in the region.
Yes, I think I heard all of what you what you asked. It was just, I think there was a glitch with the network. But what documents are available? So yes, definitely civil society. There's a lot of documents, and I think one of the things that you know, different pieces have been done have actually been a really good example is tracking of domestic financing within certain governments, right? So civil society do really well with this because they literally whip the government into shape, and they tell them, this is how much you said. Like they're like that reminder at the back of your head, just on you know, breathing down your neck and telling you, you had said you'd do this, but then you went and did this. Why? And you did not tell us. But another thing also, I think I wanted to also just emphasize is that there are civil society organizations that are responsible for making sure that people participate in the process of financing. So for instance, public participation is a big thing that is written into some constitutions even, right? In terms of budget creation. That's where you go and advocate for health. And a lot of civil society empower communities to do this. Part of the work Amref does as well. Now, I think a lot of the global documents, I agree with Myria. The WHO is your best place to start because that's where a lot of the information is crafted, and a lot of people from across the world put a lot of work into drafting these documents. And so they give a really clear, good starting point for everyone to discuss. The next step, I'll talk about more of the local documents that you can find, the more applicable documents for specific countries. So for instance, you'll have something called the National Health Accounts. The National Health Accounts, if you want to look at a scope of kind of like a quick view of how much money is going into your country, where it's coming from, and how it's flowing within your country. Some countries have something called the national health accounts. I think the WHO is driving this, but is driving this and collaborating with governments to make sure that every country has this. So I think you should be able to access the national health accounts, even if it's not the most up to date. It'll give you a picture of what's happening. The other thing that is a really good survey is your demographic health surveys, and this is where health financing works in partnership with other things like social determinants of health. It's a really good document if you have a demographic health survey that's available in your country, because that tells you your population. It tells you a lot more about your population than you may realize in your small space. So it tells you how many people there are. It tells you how many people are in the rural area versus the public versus the urban area. It gives you a lot of detail, and in some aspects, it even tells you the key issues that you'll be having when it comes to mortality, how many people are dying from certain diseases, and that's where you can also now mix that with the national health accounts, where you see how is money allocated based off of this. So this is kind of like for your, just for you to think through and see if that would be something that would be helpful. I don't know if every country does this. I know that I've seen the Kenya does, but it's a household health expenditure and utilization survey. We call it HEWS. This document is, for me, when I was embarking on my health financing journey, it was like my, I don't want to say, kind of like my Bible, actually. The reason it was this, because it tells you everything to do with the money and how households are interacting with the healthcare system when it comes to how much they are spending. Where do they spend their money on? Do they spend it at at smaller pharmacies? Especially in Africa, you'll find a lot of people would rather go to a small pharmacy to pay to get some drugs rather than go to a bigger hospital. And there's many reasons for this. Part of that could even be wait time, because the wait time is so long. But it could also be that they're anticipating more and more expenses once they land in a fully fledged facility. So the household health expenditure and utilization survey is also it's a really good document to have on board. And then the simple one is actually a lot of governments make their budgets public. Sit down and listen to that budget. I know in Kenya, it's usually done around June, July. Sit down and listen to that budget, because that budget will tell you the choice the country has made for themselves and for the country's healthcare system. This will determine a lot. And this is not just so you can go and say, oh my gosh, I think we've already talked and exhausted the information about budget and how to look at budget and critique. There's all these numbers that you might be able to see, but ask yourself, why is this number looking like this? And what does this number mean? Don't just take the number and run with it and use it as your, I think it's your point to die on. Think about what it means. Think about how it interacts with the healthcare system. Think about what it means for that. And also remember that as we continue to make choices, I think I'll repeat this more over and over again, that there's an opportunity cost. For every choice you make, you have forfeited another choice, okay? And these are the things that you'll now complement all that information I've just told you, complement it with the civil society documents, because they tell you if this choice was made and this choice was forfeited, the rationale for forfeiting this other choice was not good. It was not according to the health system goals. Or they'll tell you that in fact, the government has done better because it was in line with what they promised that they would give. So those are the kind of complementary things. I want you to look at health financing as a system tool and driver, because it does drive a lot of things and it does eventually drive health outcomes. So I think, and at the end of the day, for all we've said, three things. Effective. Is whatever we are buying, is it effective? Is it efficient? And is it equitable? If you have not looked at those three things, right, then you have failed your healthcare system. Why I say this is because that is the balance you want to have, right? You want people to be efficient with the how they allocate resources. You want to make sure that whatever you're buying, you don't want to go and buy a car and then find that it breaks down after a few kilometers, right? So you want to make sure that it's effective. It does the job it says it's going to do, but it's equitable, because not everyone can jump on a stool and shout from the rooftops. Other people need to be fed. You need to fend for other people. So I think that's a balance you have to have. And those are the documents that you have available to you. And I'll try find some and send them through the organizing committee as well.
Thank you. Thank you so much. Dr. Adenkunle, anything you'd like to add on that?
Well, I will apologize to my erudite colleague. I won't talk policy document, but I will share some of my favorite material that has inspired me. And one of them is a movie you can find on YouTube called The Men Who Built America. And I like to rephrase it, who are the people that are going to build Africa? And it was about some of the very early entrepreneurs, the Rockefellers with Standard Oil, JP Morgan with electricity, Vanderbilt with the railroads. And basically, these were people who seized opportunities, built economies, and laid the foundation of America's economic prosperity. I believe we need entrepreneurs like that in Africa who will build the economies of Africa. That's what it's called. I'll type it in the chat box shortly, but it's called The Men Who Built America. My second recommendation is my number one business author. His name is Jim Collins. He wrote a book called Great by Choice and From Good to Great and Built to Last. They're all about businesses that became great companies. Some transformed from weak companies to great companies. Some of them are the HPs, the Sony that we talk about till today, and how they evolved and the things they did, and more importantly, the quality of leadership they had that created those companies or transformed those companies. That would be my recommendation. I'm a business person. I think entrepreneurship. And then go and read about AI technology. Thank you. That's all I will cover.
That's perfectly okay. We want to be empowered to be policy people and to be entrepreneurs. So the healthcare financing, as we've discussed today, is quite a vast field. So we are hitting almost our time limit for the panel discussion. So I'd like us to now head into closing remarks. Anything you'd like to say in summary, 2 to 3 minutes, based on our discussions, and something to a take-home message for those of us who are tuned in. I'll start with Dr. Myria.
Thank you very much. That was really a great session, and you really have to be very proud of yourselves for organizing an African healthcare student summit like that. That brings, I see we had at some point like 90 participants for different countries and different schools. So really pat yourself on the back for that, because it's a great job and it's a great start for this collective thinking and collective action that we have been talking about today in the panel. So my closing remark is that to the students who are here with us today is that it's okay if you have gaps in your knowledge. It's okay if you were not familiar with some of the discussions that we have today. But the point is that you were here today because you were curious about it and you wanted to learn about it. And of course, it's never too late to start if you're interested. I started after I graduated, after I worked as a clinician. Dr. Rispah started on her 3rd year and it was late for her. For me, it was super early and I wish I had started back then. So stay interested in these matters, because it will make you a more wholesome health professional if you know why you are doing what you are doing, what's stopping you from serving your patients and serving the right to health, and how you can fight for it with your fellow health workers. Either if you stay a clinician or if you change your field, it's fine, whatever you decide, but just keep your goal in mind, that I'm here to to make the world a better place, a healthier place for my fellow people in my country and in the continent and in the world, as the panelists said before. So really be proud of yourself that you are here today listening to this discussion and participating. And yeah, thank you again for having me. It was great.
All right, Dr. Adenkunle, closing remarks.
Yes, your continent needs you desperately, needs you urgently. Your continent doesn't need you tomorrow, your continent needs you now. And even if you can't do everything now, you can start no matter how small. And the way you will take ownership and bring change to Africa in the next 15, 20 years is by taking ownership of, first of all, yourself, your own life, to make sure that your potential does not remain potential, but you bring out the gifts, the talents, the abilities, the passions, and you bring them to the table and you begin to hone them, you begin to perfect them, you begin to apply them. You need to collaborate. One thing Africans must learn is how to work together. In healthcare, we're so often fragmented. We need to appreciate the value the other healthcare professionals and disciplines bring to the table. Doctors are guilty of that, mostly. I say, if you're a doctor, there's an occupational hazard that you will be a proud and arrogant person, unfortunately. We need to be able, and I say that, see, it's like this. Can you imagine a Premiership football team where the captain says, I'm only interested in the strikers, I don't care about the defenders? That team will go nowhere. So I like to tell doctors, if you're going to lead healthcare, then you must be able to stand up for the entire healthcare team, not just for yourself. We must understand what real leadership is and bring people together, build collaborations, build unity, and create the dreams we want. We must no longer depend on Western nations and foreign nations to tell us how to build and what to build. I met a gentleman in Ghana and I loved him. He said he was a beggar with a choice. So whenever they brought the USAID money, he would tell them, I know it's your money, but I'm going to use it for what my country needs. But beyond that, we must learn to take our resources and put them to the best possible work, do more with less, and create the Africa of our dreams. Thank you very much.
All right, thank you so much. And last but not least, Dr. Rispah.
Thank you. I was actually just looking at the Q&A section, and I see a question here. What are the mechanisms to help put like health financing concepts in place to more robustly, and what can we do as health professionals or use to push this policy? The one thing I will tell you, if there's nothing else you have heard me talk about, is work together. You are way stronger together than you are standing alone. And even if you are standing alone, keep shouting until somebody hears you. If you have a passion for your patients, if you have a passion for the work that you are doing, I'm going to just urge you to become advocates. Understand that is one of the most important roles you have as a young budding healthcare professional in whichever field that you are in. Do not forget that you should be excellent at what you do, and not saying that you have to be perfect, but just strive for excellence, because that's where it all starts. Because then once you have crossed that bridge, you can then now focus on what are the other things that are hindering me from going even further. Your work starts now, as Dr. Adenkunle said, your work starts now. It's not going to start tomorrow. It's not going to start next year. It's not going to even start when you graduate. It's starting now. And it'll just ramp up once you become a healthcare professional. You might land in a particular facility and then you're made the person who has to decide whether people will receive oxygen on one day or whether there's money for this. it's not something that you're taught, unfortunately. You're taught how to do the medicine, but you're not taught all these other things. But you're not alone. Collaborate with each other. Collaborate with people who are outside of your particular field. Collaborate with different healthcare professionals. Don't just, if you're a nurse, don't only talk to nurses, talk to doctors, talk to physiotherapists, talk to every single person under the sun, and also talk to people outside of healthcare. Because even as I said, the healthcare financing is not a vacuum. Even the health system does not operate in a vacuum. It operates in an entire country which has issues to do with infrastructure and development. Talk to engineers, have conversations with engineers about why would they be given more money than you, right? Have those sparring conversations and start to talk about them, because at the end of the day, all of you will become the people who are in charge one day, because even the people who are in charge today started off where you started. So expand your horizons so that you are not just looking very much in a silo of this is healthcare, and of course it's important. Speak to someone who thinks healthcare is not important and try and figure out how to convince them otherwise. Sit down and expand your thought processes, because you have such a big opportunity. And finally, I think the one thing I will say is that, yes, congratulations for hosting this amazing bringing together of so many brilliant minds. And thank you so much to the rest of the panelists and the moderator. It's been amazing. I think this has been an exciting, conversation. And I think what I will look to do is just be available. And Marie-Claire, I'm just putting my email in the chat box so that you can have access to me. But of course, through Marie-Claire, you always have access to me whenever you need me. So yeah, thank you for being also very engaging in the chat box. It's very good and very kind of you. Thank you.
All right, thank you so much. I know I said closing remarks, but we have two sort of related questions, though we've discussed them briefly, but I'd like us to probably at least answer them since they've been asked. One is from Fasama, Liberia, who's a medicine student. And it starts with a statement: I believe health financing is one huge challenge confronting our health system in Africa. It's something we keep talking about, even over and over again, even whispering about it. My question: what mechanisms put in place help drive this concept robustly, and what can we do as health professionals or youth to push this policy? And the second question is from Frank Abaway. I hope I've said that correctly. His question is: how can government use private sector as their partner in a country where the private sector is not strong enough to supply the healthcare need of the population? And he's a student from Cameroon, a medicine student from University of Buea, Cameroon. I think we'll just do a round of responses. I'll start with Dr. Myria. Yeah.
Let me read it. I think Dr. Rispah already answered the question with her concluding remarks. So the mechanisms to put in place to help drive the concept of health financing. So what you can do as health professional, or youth to push the policy of health financing. So as Dr. Rispah said, like, work together. I mean, you're health professionals, you're health workers. So it means that you are not alone. You have your union, you have coalitions in the countries, but also global coalitions. And I also put the handle of a coalition that I know that is operating in the global level. And like we at Wemos are co-hosting in the Health Workers for All coalition. And yeah, join the movement for health, because it is a movement. And you can operate at locally, but also globally. And Dr. Rispah is a very good example of that with her experience. And as for the question about the private sector, definitely private sector is a partner for the government. And actually, this is the way that they can contribute to help when they are working in partnership with the government and when they are regulated, to make sure that they are operating in an equitable way. And the governments, of course, can support private sector by giving incentives, by giving support, but also giving guidelines. and not just leave health only in the hands of the market. But together, it can really work well. And I'll leave it here.
All right. I still leave the floor open to Dr. Adenkunle and Dr. Rispah if they'd like to add anything with regards to the questions that have been asked.
I would just say, in terms of what students can do now, educate yourself around these policies. Many of those policies are actually very effective tools in your hand, but you need to understand how they work and how they apply. So I think the critical thing is educate yourself. Around government and private sector, the same thing. There needs to be that education of governments many times. Governments need to understand private sector better. Private sector need to understand governments better. And they need to see themselves as collaborators, part of the same team, not on different sides of the team. Because that's often what happens. They see themselves as different, as opponents, and then nothing gets done. They need to come together and say, you know what, we need to find a way to work together to build our nation and our continent.
Just hopping on there to the tail end of his sentences, yeah, private sector is such a huge player in so many different African countries, and to ignore them is to fail, to just setting yourself up for failure. The examples of this, South Africa is a good example, Nigeria is a good example, Kenya is a good example. I think almost 50% of services are delivered by private healthcare professionals. And I think the way that, as we seek to say that also you should collaborate, I think even private sector and government need to collaborate. And to be seen, private sector should be seen as a really important partner, not just in terms of service delivery, but also collaborating with government so that policies are made that are both facilitate a strong private sector, but also give the government underlying process of equity. How do we balance? How do we make that sweet balance? Because I think, unfortunately, the market in healthcare is a bit different from the market in anything else because it's. I'm going to throw in a health economics term that I hope you'll go Google, everyone. But we are vulnerable to market failures in the health sector. But I think that private sector, I have seen the power that private sector has in certain countries and how you can leverage on that to make sure it's strong and delivers what it needs to deliver. And then the government, so there's so many different roles that it can play, and there's no perfect fit for one country or another and saying that you should have X% or you should do this or you should do that, but really just understanding the context and shaping it to where you think it's best. The other answer, I think I did answer the other question, and as I said, I can talk about this topic forever, so I won't go into the other answer that I gave earlier. But in terms of private sector, those are my thoughts. And maybe something else I wanted to add was also just looking at healthcare financing and understanding the stakeholders that are involved in healthcare financing in any country. It's a myriad of people, and not just in Ministry of Health. It could be Treasury, if you have a Treasury, or Ministry of Finance. It's a civil society. It's members of parliament or legislators. It's the president himself or herself. It could be so many different people who interact, and it's a fine balance. So you're walking into a place where don't feel like you'll be alone. There are so many people, so you'll be just fine. And understanding each of their roles and how they're different parts of a moving car, they're different parts of an engine, and understanding their roles is really key to making sure that you understand how the system works. Thanks.
All right, fantastic. I really do not want to water down anything, any closing remark from what our lovely panelists have said. So mine is just to thank all of our panelists for taking time off their busy schedules to talk to us on healthcare financing. And it is my hope that we have all been empowered on matters to do with healthcare financing and rethinking financial models in the Africa region. Remember, one key thing, 15% of a chicken is not 15% of an elephant. I think that was the most comical way we can summarize healthcare financing. And remember that we are the agents of change. The future is in our hands. Do engage with your local student organizations. And we at AHESS are here to support you. So at this point in time, I'd like to give our panelists the opportunity to leave, but they are welcome to join us for the closing ceremony. We will be taking a 2-minute break because we have been sitting down, we've been seated down for quite some time. So we will take a 2-minute break for guys to stretch, grab something to drink, or head to the bathroom. And then after that, we shall reconvene and start our closing ceremony. Thank you, everyone, and see you in a bit. And there'll be a poll that will be shared in those 2 minutes. You can keep yourselves busy by filling in the poll. Thank you. Welcome, everyone. So our 2-minute rest break is now officially over, and we would like to start the unfortunate part of the Africa Healthcare Student Summit, which is the closing ceremony. All good things must come to an end, and unfortunately, this is the start of the end of our session and our summit. And with that, without further ado, I'd like to welcome Emma Nalianya, the President of the Federation of African Medical Students Associations, who will be giving us the key messages that came out from all the sessions. And as we continue, let's tune in and welcome Emma.
Okay, thank you very much, Marie-Claire, for that, and well done for the previous session. It has been very, very informative, and explosive is the word. So I'll go right into a summary of the entire summit, starting from day one, the first session on UHC. So the session was explosive and dynamic with global health experts, and the key points were that health is a human right, and the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic or social condition. That is according to the WHO constitution signed 70 years ago. So political will is also essential, and the time for lip service is over. So government must walk the talk, and leaving no one behind has been used as a buzzword in global health, but we really need to introspect and dissect the press and ask ourselves if we are truly being inclusive. We need to be cognizant of the marginalized people. Then financing is also a challenge, and we need to rethink our models. Furthermore, what compounds these challenges dramatically is corruption in many of our governments. And youth are optimistic and passionate about making a difference and obliterating the status quo, so let us keep that up. The first session and the second session have been summarized as above. So that was for day one. Both the sessions were on UHC. Then for day two, the first session on emergency medicine, the session was very productive, and we were able to expound on the various issues that affect service delivery in the field and how UHC is supposed to better the value as well as the availability of emergency care. We were also able to delve deep into the opportunities available for students and medical practitioners who are interested in joining the field of emergency medicine, and also the need for multidisciplinary approach with regard to referral systems that play a key role in providing timely care and thus cutting down the fatality rates. So that is it for the first session. Moving on to the second session on SRH, on sexual and reproductive health and rights. The session was an interesting session that focused on the menaces that surround and that surrounded and plagued the African region, and we established the fact that we had poor sexual and reproductive health and rights policies in Africa due to gender inequality and religious influences, among others. So the session also spoke about how oppression of the health rights of the LGBTQ community was affecting both ends of the equation, especially regarding HIV. And it re-emphasized the need to comprehensive sexual education in our schools in Africa. So we concluded the session by sharing ideas by which health students can, in our own little ways, contribute to the improvement of the African region regarding sexual and reproductive health and rights. So day 3 of the summit, the first session was the AU Agenda 2063 and its role in healthcare. So the session was very enlightening and eye-opening to many. We got to understand the AU Agenda 2063, what it is, its priorities, its importance, and how it is relevant for healthcare and the health of the people of Africa, as well as how we can take part in the realization of the agenda. So in a nutshell, as of 2020, in as much as Africa has made some significant steps towards achieving the goals of the AU Agenda 2063, Africa is still lagging behind in some areas such as poor infrastructure, lack of peace, lack of human resources in the healthcare system, and it is up to us to change the narrative in every way we can, such as educating the public on health and nutrition, contributing to behavioral changes, and improving policies, as well as other ways in which we can contribute. So the last session is the session that we have just concluded on rethinking our financing models. And we can all agree that it has been interesting, informative, and every good word that we can ever think of. So our amazing panelists have done justice to the topic of discussion and challenged us to rethink our financing models to ensure that they are efficient, effective, and equity is achieved, keeping in mind that healthcare financing is one of the building blocks of our healthcare system, and it is, if it fails, the entire system fails. So it's very important that we discuss healthcare financing because it determines how we will practice. And we have all been challenged to invest in healthcare as well as make sure that our leaders are accountable. And we should also purpose to be genuine problem solvers. So there is need for everyone to be financially literate. And that has been really emphasized, and all of us have been encouraged to ensure that we are financially literate. So our panelists have also shared with us amazing opportunities that young healthcare practitioners and students can delve into. And indeed, it is there is a vast array of opportunities out there. Additionally, there is need to challenge the curriculum to be more inclusive of health financing and take ownership. And we should also take ownership of our training. Finally, we are amazed at the incredible discussion and questions brought forth by the delegates. The passion and energy is evident, and the future of health looks bright in the African continent. We encourage everyone to create awareness in their own community, country, region, and the entire continent about all the topics that have been discussed, and constantly work on research and advocacy. Then I would like to finish by reiterating a question that has been mentioned at least twice by our panelists. So what do you want for yourself? What do you want for your country? And what do you want for the continent? Thank you very much. Over to you, Marie-Claire.
All right, thank you so much, Emma, for that lovely summary of the day, of the 3-day meeting that we have had so far. So next up, we now head into the vote of thanks. So a brief history, which we shared on the first day, but we will just repeat again. This Africa Healthcare Student Summit started more or less with the Kenya Healthcare Student Summit, which actually turned 3 years old a couple of days ago. And after that, we have been able to have a Kenya Healthcare Student Summit, and that now led to Nigeria hosting their own summit last year. And Ethiopia and Uganda are currently in talks or in plans of hosting their own summits. And it was with that regard, the African delegates who attended the Kenya Healthcare Student Summit decided that we should host an Africa Healthcare Student Summit. But in light of coronavirus, we decided to host a virtual summit, and that is why we are here today. And this wouldn't have been possible without the help of our partners. We have had several partners who have been with us through the planning of this ceremony. I'm just going to ask for the slide on partners. So we will start with the partners who've been with us during the sessions. That is for the emergency medicine session, we had EMIG Nigeria and the Africa Federation of Emergency Medicine. For the SRHR session, we had the Project Shiba, SRHR Africa Trust, Renate, and Project Respect. And for the youth session on UHC, we ANSI, IFMSA, IADS, and IPSF, also giving us great support with that session. This has been an online summit, and we have had to have technical support from various partners who cannot go without mention. First and foremost, that will be the Kenya Healthcare Student Summit and the Nigerian Healthcare Student Summit, as well as the Federation of African Medical Students Associations, who helped in the planning of this summit, to get the sourcing of speakers, and ensuring that this summit becomes a success. With review, we've had about 37 speakers talk at our event, and I'll be giving more details on our speakers shortly. And with regards to the Zoom account, I would like to thank the WONCA Africa, that's a federation of medical, of family medicine doctors in the region, as well as Project Respect for enabling us to use their accounts. So last but not least, I'd like to now hand over to Mashkur to finalize this great summit.
Yeah, I think we wouldn't do justice if we don't give thanks to our eminent and prestigious panelists and speakers. We all through the whole 3 days of this event, it's been a time of learning, a time of reflecting, a time of getting inspired and being motivated. I think I speak for everyone when I say that we are all motivated and we are more enthusiastic about making impact in healthcare in Africa after these 3 days, because with the passion and enthusiasm of all the speakers has actually been contagious. And right now we all want to go forward and do something that's really going to create a positive impact for Africa. I'd like to give thanks to Professor Musa, Dr. Al-Qadi, Shakira, Noob, Dr. Michael, Mustafa. Just there are so many speakers, and we really, really appreciate the time and effort they devoted to come here and share their knowledge, share their experience with all of us. We wouldn't be anywhere without them. I'd also like to thank you, attendees. It's not easy to sacrifice your time. For 3 days, you've sacrificed several hours, you've sacrificed your data, internet connection. Some people have sacrificed going to classes, some people have sacrificed going to hospitals, all because we want to come together and make a change. We want to make sure that Africa is better than it is. We want to make sure that we create the Africa we want. We really appreciate your efforts. We really appreciate your presence. We're happy to always have you with us. And last but not least, I have to thank my fellow organizing committee members. This was a feat that wasn't easy, but all the team members worked very efficiently to make sure that they brought out the best from this conference. Marie-Claire, Emma, Daniel Otobo, Okot, Michelle. It's really been amazing working with all of you, and I'm really, really happy and excited to be part of you. So to talk about the next steps, I hand over back to Marie-Claire.
Thanks, Mashkur. And also, I would also like to thank Mashkur, since he's thanked the rest of the team. Mashkur has been the one behind the scenes managing the Zoom account, making sure we are keeping note of your questions, making sure we are keeping tabs on who's here, and just helping us out through and through. So this is not the end, but the start of a journey. And our theme for this conference was Universal Health Coverage, Where Africa Stands. And today is exactly 1 week to the World UHC Day. And with that, we are gearing up to the World UHC Day. We are having something in store for all those who have attended. And those who also didn't make it, also registered, we will be sending you details of how we plan to commemorate the day. And also we aim to continue having events and engaging healthcare students within the region and ensuring that the conversation on universal health coverage continues in all its various arms. We know we haven't tackled some topics, and those are topics that we will want to tackle in the near future. So from the team, we ask that you do not leave the various groups that were created, the WhatsApp group, the Telegram group, that you do save our email, because we will be emailing you guys on opportunities, and that you continue engaging us on social media. We are on Facebook and on Twitter. So share all your key thoughts of the session, what has inspired you, maintain the hashtags until we finish 2020, hashtag AHESS 2020, hashtag AHESS Youth, and hashtag Youth for UHC. And let's keep the conversation going. Let your fire not dim down now that the conference is over. Let it just now continue to ignite and be brighter and brighter and brighter wherever you are. We do hope that we will be able to meet physically and engage. And from us, before even I sign off, I remember we forgot to thank our French translating team, which is Viviane and Jean. So thank you. So from us, before we sign off, we say, don't lose your spirit. And we will be sharing key documents in the coming days, especially our call to action, which we will ask for you to sign and commit to on what we would like healthcare students to do so as to achieve universal health coverage. The theme for this year's UHC Day is Protect Everyone. So wherever you are, ensure you're safe. And with that, I'd like to sign off and say thank you, merci beaucoup. And also Dr. Myria for staying with us. Thank you so much. So yeah, thank you. And we officially call this the end of the summit.